Children who are exposed to secondhand smoke on a regular basis have definite increases in ear infections, bronchitis, pneumonias, increases of asthma problems, and other respiratory infections. I know this from personal experience. I was exposed to secondhand smoke every day as a child. I had bronchitis, pneumonias, sinus infections, and when I went to college, they stopped.
I support a countywide 100% smoke-free policy for daycare and foster care providers. We see, especially in small children and infants, we know that secondhand smoke exposure causes an increase in fluid in the middle ear, which we call effusion, and that leads to ear infections. We know that we see lots of kids with ear infections that are attributable probably to the smoke exposure.
Working with the professionals in our community, it's important that we have great daycare options available, and that means having the safest childcare environments as possible.
I support a countywide policy of smoke-free daycare and foster care homes. Smoking is a contributing factor in sudden infant death syndrome, also known as SIDS. SIDS deaths have occurred in Minnesota in daycare facilities. Smoking releases cancer-causing chemicals into the environment that settle on surfaces in the home, increasing a child's exposure to those chemicals. As parents, it's our responsibility to have all children safe from secondhand smoke.
I support a 100% smoke-free daycare and foster care policy because infants and children who are exposed to secondhand smoke have an increased risk of developing lower respiratory tract infections such as bronchitis and pneumonia. The EPA estimates that 150 to 300,000 cases of lower respiratory tract infections are seen annually, which are thought to be directly related to secondhand smoke exposure. Of these, 7,500 to 15,000 cases are severe enough to require hospitalizations. Secondhand smoke exposure is also a major risk factor for asthma. Asthma is one of the most common childhood diseases affecting 1 in 13 school-aged children. In children who already have asthma, exposure to secondhand smoke can also trigger asthma attacks, along with making asthma symptoms more severe. This is something we see in our facility on a weekly basis. Secondhand smoke exposure can cause illness. The best and most effective way to prevent illness is to simply prevent secondhand smoke exposure.
I support 100% smoke-free daycare and foster care policy. We know secondhand smoke causes approximately 3,400 deaths from lung cancer alone each year. In 2006, the Surgeon General concluded that there is no risk-free level of exposure to secondhand smoke. I have experienced the cancer care journey with many patients during the past 20 years working in the Cancer Care Center as an oncology nurse. 90% of those diagnosed with lung cancer were or are smokers. If there is anything we can do to prevent our children from experiencing cancer in their lifetime, we need to do it now. It's that simple.
I support 100% smoke-free daycare policy. As a child care provider, part of my job is providing a safe environment for the growth and development of the children. To me, that also means a smoke-free home. Children do not have a say about being exposed to secondhand smoke, so I feel it is our job to help protect them from the toxic chemicals of secondhand smoke.